starting off with asphyxia, we have the asphyxial triad, where it can be remembered by the mnemonic CPC. We have cyanosis, petechial hemorrhage, and congestion of viscera. The types by mechanism, we have hanging, which involves neck compression due to suspension of the body weight. Strangulation is only neck compression and there is no suspension of the body weight. And suffocation is asphyxia, where there is no compression of the neck at all. Fractures of the hyoid bone. The most common cause of the fracture of the hyoid bone is due to throttling, then followed by hanging, and then ligature strangulation. There's two types of fractures. We have adduction fracture, abduction fracture. Adduction fracture is caused due to inward compression, which is seen mainly in throttling. This is the most common type of fracture. Abduction fracture is outward compression, seen in hanging. And side-to-side compression fracture is one end displaced outwards and the other is inwards, is seen in hanging. This is important because hyoid fractures help to distinguish the mechanism of neck compression during autopsy. An inward abduction points towards throttling, whereas an outward or side-to-side pattern may point to hanging. Types of hanging. We have two types of hanging based on the knot position can be classified as typical hanging and atypical hanging. Typical hanging involves where the knot is placed at the occiput, whereas atypical hanging is the knot is placed anywhere except the occiput. The differences between complete and partial hanging. In complete hanging, the whole body is suspended, whereas in partial hanging, the partial body is suspended. In complete hanging, there is no contact with the ground, whereas in partial hanging, the part of the body touches the ground. Could be the leg, the knee, or any other part of the body. In complete hanging, the constricting force is the entire weight of the body, whereas in partial hanging, the constricting force is the partial weight of the body. Order of autopsy. In the case of hanging, the cranium is opened first, followed by the neck, and then in order of autopsy in hanging. In order of autopsy in hanging, the cranium is opened first and the neck is opened last. Cranium is to avoid Prinsloo-Gordon artifact, and neck is opened last. It is to facilitate a bloodless dissection of the neck. Glove and stocking pattern of hypostasis is seen. This implies a vertical position. It does not imply hanging, but may be seen in hanging. Antemortem findings in hanging. Web of the face. The face may be pale or congested. Dribbling of saliva is seen. This is the surest sign of antemortem hanging. It occurs at the opposite side of the knot. Laphasie sympathetic. This is pressure on the cervical sympathetic chain, which causes ipsilateral eyelid opening and ipsilateral pupillary dilatation. This is a sign of antemortem hanging. Other signs in the face are facial congestion, petechial hemorrhages, protrusion of the tongue, and bleeding from the ear, conjunctiva, and nose. Ligature mark. Typical features of a ligature mark is it is oblique, incomplete, it is placed above the thyroid cartilage, and it causes a pressure abrasion, which can be seen as a pale, dark brown, parchment-like abrasion. The suspension peak is an inverted V shape. A transverse ligature mark is seen in hanging in two special situations. It can be partial hanging, or which is due to a low point of suspension, or a slip knot with a running nose. Internal findings. We have in the hyoid bone fracture is seen in 15 to 20% of hanging cases, and the increased age is a risk factor for hyoid bone fracture. Carotid artery, Amusat sign, is that the transverse intimal tear of the carotid artery caused by overstretching of the artery wall during suspension. Vertebra, C2 fracture is also called as hangman fracture. C3 and C4 fractures are rare. Simon hemorrhage is intervertebral disc hemorrhage. The manner of hanging. All three internal findings, as mentioned above, are typically seen in hanging with a long drop, as seen in judicial hanging. They are much less common in ordinary suicidal hanging with a short drop. Hanging may be suicidal, homicidal, or accidental. Suicidal is the most common method of suicide is hanging, followed by poisoning. It is a painless death with a short fatal period. Homicidal hanging is seen in judicial hanging and lynching. Lynching is a form of homicidal hanging carried out by a mob. It is a punishable offense. Accidental hanging is seen in autoerotics or sexual asphyxia, also called as hypoxiphilia, asphyxiophilia, or cochoirism. It is asphyxiation used for sexual gratification, where the person sees erotic hallucinations to attain orgasm. Most commonly seen in male perverts, it is a form of masochism. Scene clues at the crime scene may be naked body, a pornographic material may be seen, absence of a suicide note, and transvestism. How to distinguish between a suicide from a homicidal hanging? In judicial, hanging is legally sanctioned execution with calculated long drop to ensure quick death, and lynching mimics suicidal hanging but typically shows additional injuries from restraint or assault before death. In homicidal hanging, there may also be movement of the body leading to abrasions seen on the body. Strangulation. Methods of strangulation, we have ligature strangulation, where a ligature is tightened around the neck. Manual strangulation or throttling is compression of the neck using the hands. Mugging is compression using the bend of the elbow or the forearm. Bansdola is compression of the neck using bamboo sticks. And garrotting is compression using a ligature cord, often from behind. Ligature strangulation and throttling. Ligature strangulation, the ligature mark is transverse, complete, and seen usually below the thyroid cartilage. Underlying skin shows extensive extravasation of blood, and bruising is present around the ligature mark. Throttling. External findings may be nail marks or six-penny bruise, which is indicative of manual strangling. Internal findings may be extensive soft tissue contusion, adduction fracture of the hyoid, which is the most common pattern seen, cricoid cartilage fracture. The most common pattern of hyoid fracture is adduction fracture in throttling. Mugging. Mugging is compression with the elbow. It produces carotid choke, which compresses carotid arteries, cutting off blood flow to the brain. And compression with the forearm causes an air choke, which occludes the trachea, cutting off airflow to the lungs. Elbow or carotid choke causes rapid unconsciousness due to cerebral hypoxia even before the airway is affected, and forearm choke causes death. Death occurs due to asphyxia rather than cerebral blood flow loss. Smothering. Smothering is a form of suffocation where there is closure of the mouth and nostrils together or obstruction of the airway from within. Well, accidental smothering is children playing with a plastic bag can lead to suffocation. Adult falling into a pile of sand or mud. Homicidal is intentional smothering with a pillow or hands. If hands are used, this can lead to perioral injuries or lip injuries. Medicolegal significance. Smothering is one of the most common methods of infanticide and is often used in child abuse cases since it can leave minimal external evidence. Perioral and lip injuries strongly suggest homicidal rather than accidental cause. Gagging, choking, and café coronary syndrome. Gagging and choking. Gagging involves placing a cloth or pad thrust into the mouth, leading to pharyngeal obstruction, leading to asphyxia. Choking. Choking is where a foreign body enters the airway, leading to respiratory distress, leading to asphyxia. Management is Heimlich maneuver. Café coronary syndrome. This is where a food bolus enters the airway, leading to sudden collapse and death. It mimics myocardial infarction. The cause of death is vagal inhibition of the heart. This is caused due to a decreased gag reflex seen in intoxicated patients. Therefore, there's vagal inhibition of the heart due to a food bolus getting stuck in the pharynx. Traumatic and positional asphyxia. Traumatic asphyxia is caused due to heavy weight on the person's chest, leading to restriction of chest movements. Mask ecchymotic. This is a pale chest with a cyanosed face. This is due to decreased venous return. Cyanosis, petechial hemorrhage, and subconjunctival hemorrhage. Positional asphyxia. This is asphyxia which is caused due to abnormal position of the abnormal position leading to restriction of chest movements. Jackknife position, inverted crucifixion, burking, smothering, and traumatic asphyxia is combined, and overlaying. In jackknife and inverted crucifixion, there is the abdominal content press against the diaphragm, leading to decreased chest expansion, which leads to positional asphyxia. Dry and wet drowning. Most drowning deaths are accidental. The difference between dry and wet drowning is in dry drowning, there is reflex vocal cord spasm which blocks air entry into the lungs, therefore causing asphyxia. And wet drowning is water enters the lungs, leading to asphyxia. Hydrocution and immersion syndrome. Hydrocution is when a person falls into cold water, usually below 5 degrees Celsius. This stimulates vagus nerve, leading to bradycardia and cardiac arrest. Secondary drowning. is when a person is rescued and then dies from the complications, that is electrolyte imbalance, hypoxic ischemic encephalopathy, or metabolic acidosis, also called post-immersion syndrome. Fresh water versus saltwater drowning. Freshwater drowning leads to hemodilution. This is RBC swelling leading to rupture of RBCs, hemolysis. This potassium release causes hyperkalemia, leading to arrhythmia, and hypervolemia, leading to cardiac overload. Saltwater drowning leads to pulmonary edema and respiratory failure. There's hemoconcentration, that is, increased sodium, chloride, magnesium, and strontium in the blood, and increased hemoglobin level due to crenulated RBCs. Specific findings in autopsy, we have cadaveric spasm. Grass or mud may be tightly clenched in the hands of the victim. It is the surest sign of antemortem drowning. Froth in the nostril or mouth, seen in violent respiratory struggle. It is fine, copious, tenacious, mucoid, and persistent even after wiping. Absence of froth may be in dry drowning, hydrofusion, or if the person was unconscious at the time of drowning. Non-specific findings and lung changes. These are seen in both antemortem and postmortem drowning. Cutis and serina or goosebumps. It is also seen in rigor mortis of erector pili muscle. Washerwoman's hands and feet. This is imbibition of water into the skin, leading to wrinkling, peeling of cuticle, bleaching, and soddening. It only indicates time since immersion. Lung change is seen. Emphysema aquosum. Emphysema aquosum is seen in conscious drowning. The lungs appear voluminous, crepitant, and ballooning out, and mud particles in lower airway. And edema aquosum. This is marked lung edema and decreased frothing seen in unconscious drowning. Emphysema aquosum is seen in conscious drowning, whereas edema aquosum is seen in unconscious drowning. Paltauf hemorrhages may be seen in the on the lung due to rupture of alveolar wall. Test for drowning. We have Gettler's test and Diatom's test. Gettler's test principle compares chloride concentrations of blood in the right versus left chambers of the heart. Normally, the left and right chambers of the heart have equal chloride concentration. In wet drowning, there is more than a 25% difference between the left and the right side of the heart. If right is more than left, at least it is hemodilution, which means freshwater drowning. And if left is more than right, it is saltwater drowning. Diatom test. Diatoms are unicellular algae with silica outer wall. They are resistant to heat, acid, and putrefaction. On microscopy, diatoms can be found in the spleen, heart, and bone marrow. Inference is it confirms antemortem drowning as diatoms entered via intact circulation. The drawback of both Gettler's and diatom tests is they are not useful in dry drowning and hydrofusion. Thank you.